Hello, my name is Dr. Alaa Rostom. I'm an Associate Professor of Medicine and Community Health Sciences at the University of Calgary in Calgary, Canada. I'd like to share with you some thoughts about our study published in Gastrointestinal Endoscopy. This is a validation study of a nurse-assessed patient comfort score. Quality is important in all areas of medicine, but it's particularly important in colonoscopy-based screening programs because the benefits are finite, since not all patients will develop colon cancer, but each may be at risk of a procedural complication. We believe that comfort is a critical component of ongoing quality monitoring and improvement programs. Comfort is a determinant of the overall patient experience and is associated with improved patient satisfaction and compliance with repeat colonoscopy. Comfort is also a measure of endoscopist technique. Procedural comfort can be achieved through meticulous attention to endoscopic techniques such as loop prevention and loop resolution, or arguably through deeper levels of sedation. The depth of sedation employed during colonoscopy varies from center to center, region to region, and country to country. I'm not going to wade into the debate of the merits of minimal to moderate sedation versus deep levels of sedation, but clearly centers that utilize deep levels of sedation will need surrogates of procedural comfort and safety, such as perhaps a post-procedure questionnaire of patients' abdominal symptoms for quality monitoring, rather than an in-procedure comfort measure. There are many reasons for an uncomfortable procedure, but one reason may be poor endoscopic technique. And while deeper levels of sedation may improve the overall patient experience, it is unlikely that deep sedation would reduce the risk associated with poor endoscopic techniques. In centers employing minimal to moderate sedation, comfort is typically assessed with a pre-discharge questionnaire or a 1-week post-discharge questionnaire that the patients mail back. While this is a valid and acceptable method to measure procedural comfort as part of an ongoing quality monitoring improvement program, it does not allow intervention at the point of patient care during an uncomfortable procedure. Furthermore, if we had a reliable and valid method to assess patient comfort during the procedure, then comfort in itself can move from an auditable outcome to a true quality indicator with set standards. We therefore developed a nurse-assessed patient comfort score to be utilized during colonoscopy. We found that the NAPCOM score showed high levels of agreement between two nurse raters. As well, there was high correlation between the nurse raters and the physician assessment of patient comfort, as well as the patient assessment of the comfort during the procedure. We also found that a NAPCOM score of 6 or greater corresponded with a patient assessment of the procedure as being moderately or severely uncomfortable. We therefore recommend that this value be used as a point of reflection during the procedure such that the discomfort can be addressed. This may entail reassessment of the pros and cons of continuing the procedure, perhaps with changes in endoscopic technique or deeper levels of sedation, or consideration given to alternative means of screening or surveillance that may be available at the center. The nurse rating of colonoscopy comfort has many advantages, but it may be perceived negatively by endoscopists. Therefore, we recommend that measures be taken in advance of introducing these measures in order to obtain endoscopist buy-in. In summary, the NAPCOM score is a valid and reliable method of obtaining procedural comfort scores. We hope that it will assist you in your ongoing endoscopy quality monitoring and improvement programs. If you have any questions or suggestions about this scale, please don't hesitate to contact me. Thank you very much for your attention.